Hello, my name's Anita England. I'm a paediatric diabetes clinical nurse specialist in Cornwall. I'm the lead nurse for paediatric diabetes. We submit to the National Paediatric Diabetes Audit annually, and we're pleased to say that year on year our results have improved. In 2012 we went over to best practice tariff, and with the best practice tariff we were then given extra funding that we could improve our service by recruiting more nurses, dietitians, psychology and data coordinator. This has really helped us to achieve some of our really good results, which we're really proud to tell people. So part of the National Paediatric Diabetes Audit, we have got to do an annual review. Part of the annual review we've got to do HbA1cs, which is a measure of control of their diabetes. And the government want or would like children or people with diabetes to have a HbA1c of 48 millimoles per mole. This is really hard to achieve, and previously, before that, it was 58 millimoles per mole. Now, when we first started the National Paediatric Diabetes Audit, our results were 67.5 millimoles. This was actually better than the national average, which was 69, but we knew that we needed to make improvements, and with the extra nurses and the extra funding we were able to do that. So year on year we've actually now got a median in the last National Paediatric Diabetes Audit of 59. We know that we need to improve further, but it is hard to get. However, with determination from our team and the families taking on board wanting to improve their child's outlook, they've actually taken on board what we'd like them to do, even though we do know that it's quite challenging. We would expect children to do between 6 and 8 blood tests a day, and also as well to do injections maybe 6 or 8 times a day, which is a lot to ask, especially when you've got a 1-year-old child. We have 210 children on our case books, and we've got quite a lot of under 5-year-olds, and we're fortunate that the Trust has funded continuous glucose monitoring, which assists with this for the children, so parents can then see what the children's blood glucose readings are every 5 minutes and can follow them throughout the day and night. As part of our annual review process, the children all have to have care processes, and the care processes consist of blood pressure, height, weight, BMI, a HbA1c. They also need their bloods taken, and if they're over 12 they need to have their eyes checked, the feet checked, and psychology screening. And fortunately we've been awarded a positive outlier status for the care processes, that we've actually managed to achieve these. So the next steps that we want to improve on, and we know we need to improve on, is transition. Presently our children transfer over to the adult services after the GCSEs, so they could be 16 or 17, which we know is not ideal when they're going over to college, when their circumstances have changed. They're going from a normal routine at school and then going to college. We know that sometimes their control can deteriorate. We also know that when we see the children, we'll ring them and chase them up, whereas when they go over to the adult services, they just can't chase the young people like we do, and so then of course their control can deteriorate and then lead to possible complications later on in life. So all these things, if we can have the children have their control as good as possible when they go over to the adults and keep it, that's ideal. But we do know that really we need a young person's nurse in that interim of the 16 to 19, and that's one of the things that when we had best practice tariff, we could have improved our service on that, because we could have utilised that money. However, we're now on a block contract, which unfortunately we can't really improve our service within the money that we've got. The other improvement, we haven't had a psychologist for 9 months, but now we've just appointed somebody, so hopefully we'll be able to have some psychological groups with young people, so transition groups, newly diagnosed groups, groups with people who've got type 2, and it's quite exciting really that we can now we'll be able to deliver these again to our patients in our service. Another thing that is really good about our service is we've got a brilliant charity which is called Supporting Cornwall Young Diabetics, or SKID for short. They do some brilliant things for the children and young people, such as go-karting, clip and climb, silent discos, and they actually fund a lot of things for our service, so they're just a really great resource for our service and for our children, and good support for children and families, which we're really grateful for, really.